Hi, I'm Steve Lindheim, and I'm the Associate Editor for Videos in Fertility and Sterility. With me today are two new Associate Editors, Drs. John Petrosa and Rebecca Flicht, along with Editorial Board Member Dr. Press Perry. Fertility and Sterility has always sought innovative and engaging ways of communicating breakthroughs in reproductive medicine. Successful, scientific, and educational videos are driven by a passion to demonstrate skills and data validated through experience and science. Without inspiration, videos can feel flat and boring. Without adequate experience and science, they can be misguided. As a videographer, you have to find a balance in engaging both the heart and the head for the content you are sharing.
For video recording, high resolution is essential. Now, if you have a rare case with interesting pathology, you may actually want to adjust your recording settings before the case even starts. 4K is becoming the future of video submissions, but at the same time, currently 1080p is standard and 720p is the minimum. Unfortunately, 480p is just too grainy to be used for most modern submissions. Moreover, you can record with higher resolution, but if your intra-abdominal conditions are unfavorable, it will lower resolution, and this can happen when you have smoke plumes or high humidity at laparoscopy, or similarly, if you have a lot of intracavitary blood at hysteroscopy. Now, you can use video editing software to partially offset this through a brightness correction, but unfortunately, this is lower resolution than if the settings had been right for the original surgery and video recording. Now, another thing that can also be done is you want to use the original video as much as possible because later generation copies can be grainy, and you also want to make sure that when you record, you watch for recording video compression, which can further reduce resolution. Also, to improve the experience for viewers, you can actually pause the video and then label it for things. And again, if these various techniques like magnification and cropping and labeling seem difficult to you, you can do a quick YouTube search and find techniques for how to do this with most major video editing software. Also, slow and accelerated time-lapse have their roles, but for the most part with accelerated time-lapse, it is easy to lose focus, and it may be preferable to have standard time-lapse where you zoom in on the particular area of interest in standard playback mode for the optimal clarity.
For audio quality, high resolution also makes a big difference. Though many think that their laptop microphone is sufficient, these kinds of microphones often pick up background air conditioners, as well as hisses and static. Another common mistake is when authors record audio at different locations and time points. Although this makes editing easier than a single take, it can also lead to unprofessional and uneven sounding audio quality, where a narrator speaks louder or softer in different sections, as well as with different intonation. Single time point and location audio recording usually corrects this. Additionally, authors can use the internet to create a recording box with inexpensive noise-reducing foam. Further, boom microphones have become more affordable and can be highly effective in noise reduction without the need for insulated microphone boxes. Though background music can be done tastefully, most of the time we find it to be distracting. Also, narratives should be done in clear English to maximize the impact of the video. Effective communications are not just a series of words, but incorporate inflection, enunciation, and timing.
For content, many successful videos use a clinical vignette model, leading into the video with the relevance, epidemiology, and pathophysiology of a particular medical condition or surgical approach before discussing the details of a particular patient. Given the limited amount of time available, emphasis should always be on the pertinent positives when reviewing medical history, so as not to take up too much text or too much time with your presentation. Dynamic sonography or rolling CT or MRI images, pausing to demonstrate critical findings, help engage the viewer when addressing the background. Though context matters, video submissions aren't intended to be review articles. If the majority of your video is spent establishing context and reviewing the relevant literature using PowerPoint slides, then 30 seconds of a surgical video does not achieve the balance intended for a video submission. Recognizing some rare exceptions, at least half of the submissions should be video that would not readily translate into a written case report. Also, automated spelling and grammar checks can catch many common mistakes found in background slides and will help put your best foot forward. Additionally, comparison to other surgical techniques that have been reported, as well as outcomes data, is invaluable.
For flow, the goal is to maximize value in under 7 minutes allotted. It is often low yield to include videos characterizing trocar placement, suctioning and irrigating the pelvis, and other basic skills. Similarly, narration should be pertinent to the video and should be continuous. Long pauses and silences are a lost opportunity to educate the viewer. For example, if the video shows a retroperitoneal dissection, some dissection should be included addressing the anatomy or surgical technique. Silence causes the viewer and reviewer to wonder if the video has been muted. In short, all videos should be of a quality where the creators would still enjoy watching it even if they weren't the authors. At Fertility and Sterility, we're privileged to see some of the best videos in reproductive medicine. We look forward to seeing your submission and hope this video is a helpful guide. Please continue this discussion through FMS Dialogues online to further advance women's health. Thank you.